can't tell that it's normal condition, it's not correct, yeah? You should tell, if patient can move normally, he is conscious, you can tell, satisfactory condition, yeah? Then next, show, yeah? How old are you? 21 years old person, normal show? Yes. Normal show. Then next step. Consciousness. What questions you will ask him? Where are you now? What else? What other questions?
What day?
What day? What is the date today? Sometimes people don't remember what is the date today. Possible like this, but it doesn't mean that it's day of consciousness, yeah? Okay, clear or alert consciousness, then next step. Posture, active, he can move, yeah? Face. Normal face, you should tell us there are no specific faces. Specific faces, you remember cardiac faces, endocrine faces, nephritic, hippocratic, and so on. Yeah? Normal face, there are no specific faces. Then, weight, height, and constitution. Weight and height will measure in admission department when patient hospitalized. Yeah? And now let's determine his type of constitution. Please remind me what symptoms we should check to determine type of constitution. Neck. What can you tell about his neck?
Neck is thin.
Thin and long. Yeah? This angle between neck and shoulder.
It's more than 90.
More than 90. For example, this angle is 90. Yeah? 90.
More than 90.
More than 90. How?
No, it is
110, yeah? Okay. Then next characteristic.
The abdominal part and the thoracic part.
How to check? Chest part till the rib cage. Relax so much. This one. And from the rib cage to the trochanter minor.
Chest part is more than abdominal part.
Chest is greater than abdomen. Then extremities.
Long
and thin. And longitudinal diameter greater than
the
transverse
horizontal
diameter. Clear? What is your conclusion?
Asthenic.
He is asthenic. Okay. Then next. Skin. Examination of the skin. First of all, position of your position and position of the patient. You may see this light is not good, especially to find jaundice. Yeah? It gives yellowish color. That's why how to stay according to the daylight. But you should stay like this. Window should be behind of you, not you. Our patients should stay like this in front of window. First, before you tell about the color of the skin, you check color of the skin. Then you check sclera, look upward, conjunctiva, open your mouth, tongue upward, okay, under the tongue, okay, clear? We check color of the skin, we check mucous membranes of the mouth, sclera and conjunctiva. And now we may give a conclusion about color. Color of the skin is normal. It looks like, he looks like pale color of the skin. Yeah? Pale.
He's asthenic.
But conjunctiva normal, mucous membranes of the mouth normal. Yeah? No jaundice, no paleness, no cyanosis, no hyperemia.
Yes.
Clear?
because of the weight.
Asthenic person usually has more white skin because of bad development of the vessels. Superficial vessels. It's deep location.
Yes.
Okay, then pigmentations, depigmentations. No, vitiligo we don't see. Yeah. Some pigmentations also we don't see.
No.
Yeah? Okay, then skin scars. Do you see any scars? But for example, on the left shoulder, yeah, we may see small scars, diameter 1 centimeter, white color after vaccination. Yeah? Not like this, you should describe. After vaccination, do you feel any pain? Painless. Like this. All scars you should describe like this. There are no skin rashes, skin eruptions. Absent. Yeah? Then we start palpation of the skin. Palpation of the skin. We should determine first elasticity or turgor of the skin. Normal. Yeah, and then palpation to determine dry or moist, to determine temperature and to determine pain. How to palpate? We palpate by this part. You don't see. How to say? Like this. Everybody will see. First, frontal part. Like this. Neck. If you will feel pain, you will tell us. On the back. Then hands, and last one, palms. Did you feel any pain? Okay. Temperature is normal, no fever. Skin is dry, only palms are moist and cool. Yeah? And did you feel pain? No pain, like this. Clear? It's palpation of the skin. Then next, subcutaneous fat, yeah? Development of skin we finished. Yeah? No questions about it. How to do it? Subcutaneous fat. Make skin fold, yeah? Abdominal region, skin fold. And width of this skin fold, here will be 2 centimeters, yeah? Normal here. Then on the back, below the scapulas, horizontal skin fold. Normal, don't worry. And posterior surface of the, pay attention, don't catch muscles. Only skin with subcutaneous, not muscles, yeah? And look at skin, you asked what does mean desquamation. You may see excessive desquamation. Very dry skin, and in winter very often you may see it. What excessive desquamation of epithelium. Clear?
Is the peeling of the skin?
Clear. Clear? Okay. Then, it's deposition of the fat. There is no excessive deposition of the fat, no symptoms of cachexia. No? Clear?
Yes.
Clear. Then next,
Nails.
edema. We forgot nails. Yeah?
Yeah.
Nails and hair, no, it's very easy. Configuration of the nails normal. Brittleness, how to check? Easy or difficult to avoid. White spots we don't see. Hair, normal growth of the hair, male type, yeah? Color of the hair, normal. And then try to ignore. No intensified brittleness. Yeah, then subcutaneous fat and then edema. How to check edema? On the sternum. No fossa, no edema. On the back, here. Not in sacrum region, we don't see. Huh? And how to check it on the lower extremity, special sit down. Please. Take it like that. Oh, one leg, we will show you. How to check? You press by the thumb over the bones and go upward over the tibia. Not here, it's not correct. Over the tibia only. Not like this. Yeah. We don't see any force, it means no edema. Then next, lymphatic system, and then will be musculation. Lymph nodes. We palpate by 4 fingers. Normally lymph nodes are not palpable. Before palpation, we should look at the region of lymph nodes. Why? If you see any redness, yeah, hyperemia, if you see any swelling over the lymph node, yeah, because why we should do it before palpation? If you palpate at this place, of course, after your palpation will be redness, yeah, and it's not exact symptom. Clear? That's first of all inspection, no redness, no swelling, no scars over the lymph nodes, and then try to palpate. Groups: occipital, posterior auricular, anterior preauricular, cervical, pay attention, sternocleidomastoidus, posterior cervical, maybe here, here, that's right, palpate along this muscle. Clear? Anterior cervical. Do you see? We don't see. Then submandibular. How to palpate? Bend it forward and slightly on one side, like this. We palpate this group, submandibular, and when we palpate submandibular, they locate it very deeply, and you should do like this. Then another side, do you see? Oh, difficult. Painful. Little bit off. Right submandibular lymph node is palpable. It's single lymph node, diameter approximately 1 or 2 centimeters, soft elastic consistence, mobile, slightly painful. You should, then you should think why it's enlarged. Yeah? Then submental.
Enlarged. Inflame lung.
So submandibular slightly on one side, yeah? Submental bending head forward. Clear?
Yes.
Then supraclavicular, infraclavicular, then exit. I take a sheet, okay? When we palpate axial lymph node, hand of the patient is relaxed. You will raise his hand, put your fingers vertically to the axillary region, and then when you put his hand down at this moment, you will be careful. Info. Palpate, yeah, on another side. Like this. Relaxed. Muscles should be relaxed. Absolutely relaxed. Like this. Clear? Obligatory to palpate this group. Very often metastasis of the cancer of the lungs to the axillary lymph nodes. Cancer of the stomach also. Supraclavicular and axillary. Then cubital or epitrochlear. Very easy. Relax your head and palpate in cubital fossa and slightly upward. For this group located here. If it's enlarged, you will feel. Clear? And last one, inguinal and popliteal in horizontal position is to check. Clear? Okay, normally lymph nodes are not palpable. If you palpate, you should describe characteristics. Then next, musculation. Symmetrical development of the muscle. Symmetrical. If you have any doubts, you should compare circumference of the muscle, check, yeah? Different or equal. In healthy person, it should be slightly different. Yeah?
Yes.
For the right-handed person. Right? Yeah? More greater than left one. Yeah? Okay, then palpate muscles to find any pain. Do you feel pain? No pain, no symptoms of myositis. And how to check strength of the muscles? First, you will give 2 fingers, do you see? 2 fingers to the patient, and you will press. Why I cross your hands? Why? I cross my hands and my right hand will be his right hand to determine. Yeah, it's easy. Press my fingers. Don't worry, press. Very weak muscles. Press. You're very weak. Okay. Ask the patient to press as strong as possible. And you should tell strength is symmetrical. It's obligatory. Symmetrical. Then how to check strength of the flexors? You will flex. One hand you put on the shoulder and you will flex. I'll try to extend. So we'll check strength of the flexors. Like this. Obligatory to compare with another side. Normal, symmetrical. And opposite strength of extensors. No. You will extend like this. Clear? Normal strength of the muscles. It's symmetrical. How to check low extremities? In horizontal position, patient will flex, you try to extend. And opposite. Clear? Then, how to check tremor? Very easy. Put your hand like this. Both. And you may see tremor. Oh, present. Slightly. No? Maybe like this, no? No, in Parkinson's disease, very intensive tremor, yeah, very easy to see. And flattened tremor like this, and try to stay in this position approximately 1 minute. Yeah? Of course, patients with flattened tremor, especially characteristic symptom of liver disease, can't stay like this. It always will be like this, like flattened tremor. Clear? Enough. Then next, bones and joints. Bones. Configuration of the extremities normal, yeah? There is no visible deformation. Then when we palpate muscles, of course at the same time we palpate bones, yeah? And if it will be fracture, patient will feel it, yeah? Severe pain, and you will feel displacement, crepitation, and you will see deformation. Clear? Then joints. How to examine joints? As example, let's describe one joint. All joints we describe according to the one scheme. For example, this joint. Configuration of the joint. First, compare with another one. Normal. No visible deformation of the joint. No swelling. No redness, hyperemia. Yeah? Then, if you will see swelling, yeah? It's accumulation of the fluid maybe in the joint. You should check fluctuation. Fluctuation, it means movements of the fluid. How to do it? like this. If fluid is present in the joint, you will feel this movement. So we call it fluctuation. Clear? In symptoms of one of the symptoms of arthritis. Then next we should check temperature. In arthritis, maybe local increasing of the temperature. How to check it? Over the joint, this joint, that joint, yeah, and then here and here. Clear? No increased temperature. And then we should check function, movements in the joints. There are two types of movements, active and passive. Active, patient do like this, flexion, extension, abduction, adduction, rotation, one side, another one. Do you see? You look at this movement. Normal, not limited. For example, when we believe the patient can't flex or can't extend completely. Do you feel any pain? No pain. And we didn't hear any sounds, crackle sound. Clear? Passive movement the same, but all muscles of the patient relaxed. You put your hand on the joint and do all this movement by yourself. Yeah? Patient's muscles are relaxed. The same. Movements are normal in full volume, not limited. You didn't feel pain? No pain and no crackle sound. Why we should check active and passive? To differentiate, is it inflammation of the joint or is it inflammation of the muscles? If it's arthritis, both active and passive movements will be painful and limited. Yeah? If it's inflammation or trauma of the muscles, tendons, active, very painful, but passive, when you hold hand of the patient, will be not so painful. Clear difference? Okay, it's about joints. According to this scheme, we should describe all joints. Then next, head. Size of the head. Normal. Yeah? No enlargement, no deformation. We can't see because of the hair. That's why we should palpate to find any deformation. No protrusions, no depressions, no scars. And do you feel any pain when you palpate it? No pain. Clear? Nose. Configuration of the nose. Normal. No deviation of the septum. Wings don't take part in respiration. No herpes. Yeah? Lips. Normal color of the lips. No herpes, no fissures. Eyes. No exophthalmos, no anophthalmos. Yeah? No ptosis, we don't see pupils equal, symmetrical. No sclera conjunctiva, we checked before. It was normal. Ears. Normal, yeah? No any pathological symptoms. Then neck. Configuration of the neck is normal. Okay? And how to palpate thyroid gland. Now I'll show you 3 methods, and all these methods you should remember, and you should repeat it when you will answer it on exam. Okay? All methods are very important because one method will help you when it will be diffuse enlargement of the thyroid gland. Another method more useful when it will be nodular enlargement of the thyroid gland. Now look at the patient, I'll show you. If you remember anatomy of thyroid gland, it consists of isthmus and 2 lobes. Yeah? Method includes palpation of the isthmus and lobes. First method, put your palm on the chest and palpate isthmus by 2 fingers. Ask the patient to swallow. And at this moment, palpate upward and downward. Usually, if you suspect any pathology of thyroid gland, we ask the patient to swallow too many times. Yeah? It's difficult for him, that's why we give glass with water, and when patient will drink, at this moment we will palpate. Yeah? It's for the isthmus only. No need, it's difficult. Then, isthmus. Then how to palpate lobes. Fixate muscles sternocleidomastoidus. Do you see it's very soft, relaxed, and you can palpate here. Another side. You see? Okay, it's first method. Second method, very useful if it's nodular enlargement. You palpate isthmus, the same technique, yeah, by the tips of the thumbs. Upward and downward, not like this. Lobes, how to palpate lobes. By one thumb you shift lobe to the opposite side, do you see? Okay, and now I can palpate this lobe. Be careful because the trachea is located here. Shift to another side and palpate. Clear? And third method, sit down. Especially if the patient is very tall and doctor very small. Wait in this position. You stay behind the patient. Ask the patient to swallow. At this moment, palpate isthmus. But approximately by 3 fingers here. Upward and downward. And then palpate lobes. Clear? Palpation, thank you. What questions do you have?